America's heartland, where the vast prairie meets the endless sky, where our nation's bounty is found in a multitude of crops, cattle, and commerce. This is Lisbon, North Dakota, the county seat of a strong and viable community that over 2,000 hardworking people call home. At the heart of the county is its hospital, Lisbon Area Health Services. This critical access hospital is part of Catholic Health Initiatives, whose founder's healing legacy began on America's early frontier.
When we became part of CHI, we had such high needs. We needed someone to believe in us and invest in us. We didn't have a CT scanner. Now we have a 16-slice CT scanner. We didn't have mammography. Now we have top digital mammography. We didn't have a trauma designation in our ER. Now we're a level 5 trauma center. We have come so far in the past 10 years from where we were.
Lisbon's expanded emergency services and its trained staff tackle life-threatening challenges every day. When Nick Storhog was hit by a car, Lisbon's ER was ready.
My hip was dislocated, my right shoulder was crushed, my right lung was punctured, my collarbone was broken. It was very traumatic for me. Lisbon Area Health Services emergency room care saved my life. Whatever I needed, I got, and that was critical to my survival.
When John Silvernail had a massive heart attack while driving, Lisbon's ER worked tirelessly to save him.
It's actually quite miraculous. They worked on me here in the emergency room for about 45 minutes until they finally loaded me on the helicopter. And to have that sort of medical expertise on hand was really a blessing.
When Soren McDaniel suffered an accidental gunshot wound, his mother, Holly, raced him to the skilled hands at Lisbon's ER.
I knew once I got there, then I had skilled professionals that could take care of my child and hand him over to them and then just be able to be mom and know that they were going to do everything in their power to get him the best care within that first hour of trauma, knowing that in 15 minutes, I can have the skilled health care for that member of my family. That's peace of mind to me.
But Lisbon services don't end with their ER. Follow-up therapies, such as cardiac rehab, are a key part of Lisbon's ongoing care.
It was very helpful, all of the education that they provide for you while you're doing the rehab. It's definitely made a difference. I'm in better shape now than I was before the incident.
There are serious challenges facing Lisbon's hospital that will be hard to overcome.
The challenges are with some of the different things that the public doesn't see. It's our AC units, it's our electrical, the boilers. So our lab area is very, very tight. They need extra room. When you're talking about a building this old, you can invest and you can invest, but you still have an old building.
The hospital's location in a major floodplain is the biggest concern.
Our facility sits right alongside the river that has flooded and is in definite fear of flooding again. You can't just run out the front door. We have people who are physically challenged. We have very expensive equipment. And then if something happens to the hospital, then what? Where are people going to go? What are they going to do? Are they going to drive an hour and 15 minutes if they're having a heart attack? What are they going to do?
Fortunately, the future of rural healthcare lies beyond brick and mortar. It centers on innovative ways of delivering high-quality healthcare to small towns across America. And it has just begun in Lisbon.
For us to be successful, it's going to be key for us to expand into e-medicine. The telepharmacy is so critical, being able to have our nurses and our providers access a pharmacist at all times. The EER is a program where our physicians can access other consultant physicians. We may be able to avoid a transfer. It's so important. It's so critical to our success. It will take us to a dimension that we've never had for our patients.
The only limits to healthcare in this rural farming community are the resources to accomplish it. State-of-the-art technology and electronic medicine will provide the utmost in flexibility and responsiveness. Remote experts in everything from neurology, cardiology, psychology, and more will consult and advise right at a patient's bedside. Delivering the best possible patient care, Lisbon stands to become a model of efficient rural healthcare for the entire country to follow. The seeds to this bright future are already planted in Lisbon. It can be seen in an expert touch, a heart healed, a life saved, a generation protected, and in all those who believe.